Hello, blessed and wonderfully made people. Welcome to my new YouTube office. Thank you so much for tuning in. I'm Dr. Marjorie Lewis, a board-certified physician in the state of sunny Florida. It's my pleasure to invite you in. This is your opportunity to get answers to those questions your doctor may have been too busy to answer, especially at your last visit. Send me those lab results that look like Greek. I'll start you off with a simulated patient to help guide you through the process. If you need a little extra help, let's get to it. Today's hot topic is hypothyroidism. So our first visit will be a simulated patient that comes to the office. We're going to review thyroid gland anatomy, and then we're going to talk about two centers of the brain, which we call the control center and the master gland, which I also dub the king and queen of the brain and the thyroid gland. Also, we're going to review some urgent care labs that the patient did before coming to the office. We're going to talk about something I call thyroid gland war. Very interesting. So we'll talk about why you need a thyroid gland anyway, and what happens to you when your thyroid gland stops working for you. And we're going to acknowledge that thyroid gland issues, such as hypothyroidism, is no joke. We'll do a physical exam on the patient, and then towards the end, we're going to wrap up with talking about nutrition for the sick thyroid gland, nutrition versus medication. And then we're going to conclude our visit and have the patient follow up with us, and we're going to follow the patient over several months to see how the patient does using nutrition versus medication. Okay. So this is our first simulated patient visit. The patient comes to the office, and she meets with the medical assistant, Betty. Betty's going to say, "Good morning, Miss Smith. Welcome to our office. I'm your medical assistant. So I'm going to get some basic information from you for the medical records. We're going to get your vital signs and weigh you, etc. And then you're going to see Dr. Lewis shortly." The patient agrees. All right. So here's some basic data. She's 26 years old. She's female. She's single, and she works as a receptionist. Her height is 5 feet, approximately 3 inches. She weighs about 160 pounds, and her BMI is about 28. So normal is around 18 to 25, so she'd be in the overweight category. Her blood pressure is not bad at 120/80, and her heart rate is about 70, so she's around normal. And just say we did an EKG on her, and everything was normal. Okay, so I come to the patient room. The patient is there, and I say, "Good morning, Miss Smith. Welcome to our office. I'm Dr. Lewis, and it's a pleasure to meet you. How can I help you?" She says, "Good morning, doctor. How can I find out if I have a problem with my thyroid gland?" So what makes you think you have a problem with your thyroid gland, Miss Smith? "Doctor, I haven't been feeling well for the past few months. My friend says that maybe my thyroid gland is out of balance." "Doctor, I was so worried that I went to an urgent care center and had some labs done, but I don't understand the results. Why is my TSH test results so confusing?" "Okay, Miss Smith, don't worry. I'll help you sort out the labs and see if you need treatment or just a change in your diet. Whatever you need, I'll be here for you. But before we review your labs, Miss Smith, tell me a little bit about how you have been feeling." "Well, Dr. Lewis, I've been feeling tired and sleepy almost every day. My periods are irregular and very painful. My friends say I'm always complaining about feeling cold and chilly. My hair is falling out. I feel like I'm falling apart." "Thank you, Miss Smith. I'm beginning to get a better picture of how awful you have been feeling. I'm so sorry you have not been feeling well. How has all this made you feel?" Dr. Lewis, to be truthful, I've been feeling a little more depressed more than ever, and I don't know why. I have a good job as a receptionist, but I have to sit all day at a desk, and I've been gaining way too much weight. I have the kindest boyfriend. I really have no real reason to be sad, yet I am. Miss Smith, don't worry. Together, we will get to the bottom of what is causing this imbalance in your body and find a way to fix it. Our office offers a wide range of services to meet all your needs. Doctor, thank you. I appreciate any help you can give me. I really need to get back to my old self. Miss Smith, since you mentioned that you don't really understand the function of the thyroid gland, I think it would benefit you if we reviewed some important facts about the gland. Doctor, thank you. That would be great. What in the world is a thyroid gland anyway? Let's find out. Let me explain to you what a thyroid gland is and how it works to help you. Take a look at the thyroid gland anatomy. The thyroid gland is a butterfly-shaped gland at the front of your neck. It wraps around the tube inside your neck, which is made of cartilage, and it's called the trachea. It's just below the Adam's apple, which is much more visible in men. It can be felt when a doctor stands behind you and feels along the sides of your neck. If it's too large, we call it a goiter. But a goiter is just a fancy word for an enlarged thyroid gland. However, this does not tell you why the gland is enlarged. We'll go over that later. First, just appreciate the basic anatomy of the gland. Okay, so we're going to look at the centers that controls the thyroid gland. I call this the triad. So if you look over here, you'll see this is the thyroid gland. We see the butterfly-shaped gland, and I refer to that as the factory, the energy factory of the body. Then we look at the brain. We see the front of the brain. This is a cross-section. We're looking as if you cut the body in half, and you're looking down on that half. So this part is the front, the top, the occipital, the back, and the cerebellum, the centers for balance. So right here in the center, follow this arrow, right at the tip. That is called the hypothalamus. That's the area I call the kingdom of the king. Very, very powerful, small area. The hypothalamus is the size of an almond. It's just below an area we call the thalamus above it. And just below it is the pituitary gland. If you take a look at this, this is the area called, just at the tip where the arrow is the anterior pituitary. Okay? And that is an area that I call the queen. So, the queen is the anterior pituitary, which controls the thyroid gland by way of the hypothalamus. And I'm going to explain to you how it works. But it's a tiny little pea-shaped organ, but I'll tell you, it's extremely powerful for the size that it is and controls many, many organs in the body. So the brain, these two centers in the brain work together to control the thyroid factory and controls the hormones that it makes, whether it makes too much or too little. So, let's go to the next area. Let's take a look at this control center concept. We have this red phone, which is representing the control center, which is the kingdom of the king. This is where the hypothalamus is. Remember that black arrow that looked at that little area? And it releases something called the TRH, which is thyroid releasing hormone. That releases a hormone that doesn't control the thyroid gland directly. It goes to the queen, which is just below it. And we saw the little anterior pituitary, that tiny pea-shaped area. Then this queen determines, based on the information it receives from the king, if she needs to send these messengers. These are supervisors that will be sent to the factory to tell the factory to make more hormone or less, and it will charge them up if it needs to be charged up. And you'll see this supervisors heading out to the factory below, and you see the worker there with the battery. The battery's only half charged, and so you'll see how it's going to try to charge it up. Okay, so the supervisor receives the message from the queen, and you see he's carrying this battery charger. This represents the elevated TSH. When we get the test done, and even though it's hypothyroidism, people get confused because the TSH is elevated. It's because this is a message from the brain, not from the gland. And the charge is simply increasing the charge, which is elevating the TSH, and that's how the gland is going to be pushed to make more thyroid hormone. So we're going to go on. And over here, it explains basically what I've said to you, that the TSH test reflects the regulation of the brain's king and queen. And we talk about how they're a regulatory check center to make sure that the body makes adequate energy, because it's in their best interest to make sure it happens, because the energy that the thyroid gland makes also goes back to the brain, and the brain depends on that energy to keep its kingdom functioning. So that's why they work together in harmony. So in fact, when you do the TSH test, the patient complained she didn't understand. It seemed opposite of what it should be. So the test does not directly test the function of the thyroid gland. It actually tests the response of the queen, of the anterior pituitary. That's what's being tested. So when you're not making enough thyroid hormone, she's bumping up her TSH. You're going to get more supervisors, more messages. So that's basically saying increase, increase. You need to be charged up. Send those messengers and supervisors to get that factory pumping out hormone. Okay. So we're going to take a look at the urgent care labs that the patient did. And we'll see over here that she did the labs, and the TSH is 6.2, which is elevated, or we'll explain to you that over 5 is elevated. And the free T4, which is the actual hormone that the factory should be producing, is 0.12, which is low. So Ms. Smith, we're looking at the labs. I see that your TSH, your thyroid stimulating hormone, is a little elevated at 6.2, while the free hormone is only at 0.12. So this is consistent with what we call hypothyroidism, representing that low battery state. However, since it's been several weeks since you've had these labs done, I would like to do a full thyroid panel all over again and some additional labs, which we'll discuss. Now, once again, we have the supervisor reaches the factory. You've got these guys, workers, and one says, hey, Larry, the brain wants us to make more hormone. So he says he needs to recharge our batteries. So you can see all these batteries are bouncing up and down. They're half charged. The charger's there. He's coming. He's going to charge them up so that they can make more. Now, if a person's TSH level is greater than 5, we actually call it hypothyroidism, because it's actually saying that the queen is saying, charge them, give them more charge. So that's why that represents a low battery. And if it's low, then it's the opposite. Okay, so let's move on. Here's something that's very interesting that I call the thyroid gland war. So, going back to the patient, I said the most common cause of hypothyroidism in the United States of America is a type of autoimmune thyroiditis. The thyroid gland is being attacked by antibodies. It goes by the popular name of Hashimoto's thyroiditis. The patient says, wait, doctor, do you mean that antibodies are attacking my thyroid gland? Hashimoto? Now take a look at this image of this thyroid gland. Remember the butterfly-shaped gland? This is a very sick, beaten down thyroid. And you see these structures around it, these H-shaped structures, they represent the antibodies. The antibodies is looking at this gland as a foreign body, doesn't recognize it, and we'll talk about one of the reasons why that happens. And it begins to attack it. So it's like it's got a headache, and it's hurting, and it cannot cannot do its job because it's under attack by your own body. Your own body is attacking this poor thyroid. So you've got to help out the thyroid gland, and we'll talk about how to do that. So let me explain to you what I mean by an autoimmune process is attacking your thyroid gland. So due to a poor identification process, your body's defense system may see your thyroid gland as foreign and begin to attack that gland, which is going to cause major inflammation, leading to gradual damage, and then even sometimes complete destruction of the gland. Now, there are other causes of low hormone production, such as medications, such as dietary factors. There are situations where you have inadequate or excessive levels of iodine in your diet. Iodine is essential for thyroid hormone production, and iodine can be found in eggs, dairy, seafood, and iodized salt. I call this a case of mistaken identity. So the body's defense system, you'll see misguided soldiers are attacking their own fort. Look over here, and they think they're killing aliens, when in fact they're destroying their own people. So they're angry and they're shooting at this poor, beaten down thyroid gland. If you look at the thyroid gland, it's got a Band-Aid on it. It looks sad. It's in tears. And look, the soldiers are looking at the gland. What it sees is this alien image, this green alien. They think that's what they're shooting at, an alien, and not that their own thyroid gland. So this is a case of mistaken identity, and we'll talk about why that happens. So the patient rightfully says, "Doctor, there's a war going on inside my body. Rogue soldiers, antibodies are attacking my thyroid gland. Is that what's causing my hypothyroidism?" Oh no. Okay. So don't worry though, the brain controls this war and regulates the thyroid gland response. In addition, proper nutrition and medication, if it's needed, can help you win this war. The patient says, "Okay, doctor, I'm ready to do whatever I have to do to fight back." So why do you need a thyroid gland? Let's take a look at that. The thyroid gland functions to help the heart, the lungs, the bones, and all the organs in your body. You need it for almost every organ in your body to function properly. It even helps oxygen flow through your heart and lungs, ensuring that adequate oxygen is delivered to your tissues. It helps to stimulate bone maturation, and you do need it to grow in stature and to build strong, mature bones. It's basically the energy factory, right? So you need it to help process sugar as it enters your body from the gut, and it can either store the energy or it can use it immediately as the body needs it. The same thing for fat and the same thing for protein. It helps to break them down and utilize them for energy. Your thyroid hormone has so many functions. It increases the metabolic rate, which is like a chemical process that helps your body to do its daily task. It increases digestion. It increases heart contraction, the rate of breathing. It helps to utilize oxygen properly, and it controls menstrual cycles, whether they're lengthened or shortened. And it also controls the heat that's being released from your body in the winter to keep you warm. So, when your thyroid gland malfunctions, you can feel sleepy, you can have poor memory, poor mental capacity, poor or slow digestion, poor urination, and your goiter can develop, which is a swollen gland. So the patient says, "Doctor, this does sound a lot like me." Everything slows down, and you have droopy eyelids, slow movements, slow speech, and the heart rate slows down, and the rate of breathing can slow down. You can even get constipation because you have that slow gut motility. And the patient wonders, could this be my future? You can have the blues. Start to feel tired, depressed, fatigued. You get sleepy, you feel withdrawn, and you can even feel puffy. Patient says, oh my, this is so me. So hypothyroidism is nothing to joke about. Let's take a look. You know, patients that have this can experience even muscle and joint aches, really painful. And the hair loss is a complaint that we hear a lot from our patients. Brittle nails, feeling really chilly. And then women have these heavy, irregular, painful menstrual cycles. Nothing fun about it. And then this is a nice diagram that shows you the entire body, and the thyroid hormone helps to process all these areas of the body. So just a nice image to show you how important the thyroid gland is to our overall function. Even babies can develop hypothyroidism. So if you don't correct your own malfunctioned thyroid gland, your unborn child can become severely deficient of thyroid hormone, and this is called congenital cretinism. Your child's growth can become severely impaired and could develop severe mental retardation. Your child would likely need thyroid hormone replacement for the rest of their life. So, newborns, beautiful newborns as they are, their brains do need thyroid hormone for them to thrive and be beautiful and happy. Without it, they will develop permanent retardation, growth retardation. So many things will go wrong. So it's important that this be fixed very fast if discovered. But it's a good thing that there's mandatory thyroid hormone screening that is done at birth. And obstetricians generally try to check women in their early stages of pregnancy and follows them throughout the pregnancy, because many women do develop thyroid hormone deficiency even during pregnancy and may need replacement post-pregnancy, at least for a period of time until their thyroid gland recovers. So, doctor, I certainly don't want my child to face these problems in later life. This motivates me even more to solve this issue. I couldn't agree with you more, Ms. Smith, especially since you are of childbearing age and may want to start your own family soon. So we do a physical exam. With your permission, I would like to do a physical exam on you. Then we can decide on any other necessary labs. Here's the gown for you to change into. I'll be back shortly. Okay, Dr. Lewis. So let's say we do the exam, and here are my findings. Okay, Ms. Smith, most of your exam findings appear totally normal, but I did detect an enlarged thyroid gland. But don't worry though, most enlarged thyroid glands are benign, meaning that there's little risk at your age of it being dangerous. Okay, Dr. Lewis, I'm in your hands. So, we have an ultrasound machine available in our office today, and I'm going to order an ultrasound of your thyroid gland. This will give us proof that the gland is truly enlarged, but most likely benign. Okay, Dr. Lewis. So let's take a look at this goiter. This is not the patient, of course, but the goiter, this dreaded goiter, gets enlarged because it becomes damaged, and it gets swollen as it is attempting to fix the problem. So the issue, though, to remember is that a goiter can occur in both hypothyroidism and hyperthyroidism. So it's just a swelling. It doesn't tell you what the cause of the problem is or why it became swollen. It's just that there is problems within the thyroid gland, and it's trying to fix it, and it's getting bigger and bigger as it's growing to try to make whatever it is the brain is telling it to do. So the thyroid gland can have benign lumps, it can have a nodule, and it can even have cancer. So So this is an image of what the patient is undergoing, the ultrasound. Here you see the technician moves a probe along her neck, and it's got some gel on it, and the information from the probe is being projected into the screen that you see in the background here. And the radiologist will be able to read that recorded information and images from the ultrasound and will tell us if there is a swelling, if there are lumps, if it looks suspicious, and we may need further testing. So this is what the patient had done. And we're going to send that information electronically now. We don't even have to have a radiologist in the office. We send it to them. They read the information and they send us the results. So, Ms. Smith, I have the results of the ultrasound we sent to our radiologist. He does confirm that your thyroid gland is enlarged. You do have a small goiter, but the tissue looks homogeneous, meaning we don't have any suspicious nodules there, nothing that looks cancerous. However, this may be just a simple case of your thyroid not making enough thyroid gland hormone, and that's why it's become enlarged. Okay, Dr. Lewis, so what do we do now? We're going to examine nutrition for the sick thyroid gland. So, let's take a look at nutrition versus medication. What value triggers replacement versus the need for just maybe a change in diet? Let's take a look at what's normal. The TSH, when it's normal, there's a range that we use, 0.3 to 0.5 is generally safe. So when you go above 5, we move into the hypothyroidism range. And when you're below 0.2, generally you're in the hyperthyroidism range. So your TSH is 6.2. However, Ms. Smith, most experts recommend starting hormone replacement when it's at about 10. So you're sort of in that in-between range where we can determine whether or not, based on your symptoms, if you need replacement or maybe just a diet can help to bring things back to normal. So obviously, Ms. Smith, your TSH level is below that 10. So the question now is whether or not you need replacement or just dietary changes will be enough. So let's take a look at some of the literature. So dietary changes can reset the immune system and give your thyroid gland a makeover. So we're going to look at this because the thyroid gland, if you have proper diet, might be able to reverse the immune attack from these antibodies that sees your thyroid gland as foreign. One of the reasons is because what you eat is what you become. And over a period of time, your organs can actually change on a molecular and a DNA level to the point where your antibodies no longer recognizes the organ because it's been adulterated with all the garbage food that we tend to eat that may be tasty at the moment, but over the long haul does not do our body any good. And one of the things that we need to be careful of is sugar. Sugar causes inflammation and it slows down conversion of T4 to T3. There's a lot of immune problems, causes a lot of problems in the body. So we need to go on a sugar-free diet. It may seem tough at first, but it can be done. And within a week to 2 weeks, you will not even miss sugar because it's not natural for the body. The body gets enough sugar from fruits and vegetables, healthy foods, and even proteins. When the body needs it, it can break down proteins and use amino acids to build sugar. So the body respects natural sugars and will not attack organs that utilize natural sugars that we give it. But when you use the synthetic added sugar, it doesn't like that one bit and it will attack you. So give sugar the boot and do your best to get away from it. It will do you a world of good. Gluten is another thing. A lot of people have problems with gluten allergies, so you may want to consider a gluten-free diet. Plant-based diet and vegan diets have been known. There are blue zones across the world where these people who are on vegan diets and vegetarian diets, they live the longest and they're the healthiest in the world because they're on these plant-based diets. So as long as they don't have processed foods and extra added sugar, they do extremely well. So that's something that you can consider if you can handle that. Oatmeal, you want to use oatmeal that doesn't have a lot of sugar in it. You want the plain oatmeal, not the sugary kind. That's going to defeat the purpose. Blueberries are excellent. Apples and wonderful olive oil. Can't go wrong with extra virgin olive oil. You want to also, if you're going to eat something other than vegetables, seafood is a great addition. And some of the seafoods that are wonderful for you is cod, because it has zinc and iodine that's used in the production and the maintenance of your thyroid gland. Oysters, same thing, iodine and zinc. Tuna has tyrosine, used also in the production of thyroid hormone. Shrimp, zinc, and selenium, which is a great antioxidant. And you have sardines, which have omega-3 fatty acids, and DHA. These are all excellent. You also want to try to avoid some of these processed foods like soy, and we'll talk about that. If you're not feeling that you can get adequate vitamins from your food, you can try supplementing it with additional supplements, but you want to be very careful to stay within the recommendations from the Food and Drug Administration. You don't want to overdo it, because too much of a good thing is never good. So some of the vitamins that you can take in small amounts would be selenium, zinc, glutamine, tyrosine, your B vitamins, and iodine. Iodine can be found in seaweed such as wakame, nori type of seaweed, and kombu kelp are products that you can get from the market that will help you with some of the iodine needs, though you shouldn't need very much of it. It's just a tiny little boost during the time when you're having an issue. Selenium is wonderful because it helps to convert T4 to T3, which is a more powerful form of the hormone, and it's going to neutralize some of these products that are produced when hydrogen peroxide is being metabolized to go from iodide to iodine in the body. This is in the production of your thyroid hormone. We'll talk about that another time. Selenium, as I said, is a powerful antioxidant. It can boost your immunity, lowers risk, some people say, of cancer, helps you with heart disease, mental health, and so forth. So you can take a look at this later. Brazil nuts are excellent for selenium, very rich, but you don't want to take more than 1, 2, or maybe 3 maximum, because it can become toxic after a while. So be careful with the Brazil nuts. Pecans has selenium as well. Zinc can be very helpful to the receptors in the hypothalamus, which is an area we call the king. And so you want to keep that area healthy. Glutamine is also helpful with leaky gut. So just remember not to overdo it. Okay, then we have another section here where we talk about foods that maybe you should avoid temporarily. These are called goitrogens. The reason is the word has goiter in it. It can produce an enlarged thyroid, and for a period of time, and I won't say to stop these foods forever, because a lot of these foods are very healthy and good for you, and at some point you can bring back into your diet. But when you're having problems with the thyroid, especially hypothyroidism, you may want to back off of these for a few weeks or a few months until your thyroid gland gets healthy. All right, so let's take a look at soy. Soy, we have tofu, we have tempeh. Those products are excellent normally, but they are processed foods and they can cause some problems, and we're going to talk about why later. Edamame, these are the beans. They can also cause you some issues, though they're good low carb foods and they have minerals that are useful, but during this period you may want to lay off of them. Some dairy products can be problematic, so processed foods, just get rid of them altogether. Caffeine can be a problem, so when you're having thyroid problems, stay away from the caffeine, maybe use decaf. And alcohol, you want to get off the alcohol as much as possible. Wean yourself off if you're having serious issues with it. Discuss that with your physician. Millet. We'll talk about nuts like pine nuts and peanuts. they can cause some issues for the thyroid. Peanuts, we know, causes a lot of allergies in many people and children and can be a big problem. So that's why they have this reaction, because the antibodies are attacking your body because of these peanuts stimulating these allergic reactions, because it's being viewed as foreign. So you may want to back off those peanuts. They're tasty, maybe not forever, but just for now. Some of the fruits, which I hate to say not to eat fruits are wonderful, and vegetables, but some of them can give you some problems when you're having a thyroid issue, like pears and peaches and the wonderful strawberries that are generally fantastic with fiber. And in this case, you may want to back off of them for a period of time. Sweet potatoes and cassava, stay away from these for the time being. And vegetables, which I love, cabbage, broccoli, cauliflower, and spinach. Usually everyone tells you to eat them. They're healthy, and hopefully you'll be able to go back on these after a while. But during this period of time, I would recommend that you stay off of them for a little while. So we're going to talk a little bit about the tofu and the tempeh and what they are if you're interested. If not, you can just speed forward ahead with the video. So the tofu and tempeh are both plant-based proteins. Tempeh is actually higher in protein, and they both contain anti-nutrients called phytates, which can decrease the absorption of minerals such as iron, zinc, and calcium. Tempeh is made from fermented soybeans and compacted into a dense cake. It's less processed than tofu. And the only problem is that sometimes it can be unpasteurized, and if that's the case, you may get some bacterial illness from it, so you have to be careful not to eat it unpasteurized. Tofu is similar, but it's made from the coagulated soy milk. And it's made into this dense white block. You've seen those little blocks at this Whole Foods store. And they're firm. Some of them are firm, some of them are soft, and some of them are kind of silky. So then you have the edamame, which you can see here. These are the soybeans. They're in a pod, and they're low carb foods, so they're actually pretty decent. They've got good fiber content, proteins and water, fat, and so forth. They also have some omega-3 fatty acids. So they're actually fairly nutritious on some levels, and they even have folate, manganese, and vitamin K. The problem, though, is that it can decrease iodine absorption, and iodine, as you know, is important for the production of the thyroid hormone, and it can therefore affect thyroid function. So that's the reason why we need to lay off it during the period of time when we're having thyroid issues. It also contains anti-nutrients called phytates, similar to tofu and tempeh, which can decrease the absorption of minerals such as your iron, your zinc, and your calcium. In addition, some things about soy foods is that they contain something called isoflavones, which is good in some regards to the fact that they can decrease C-reactive protein and thus decrease inflammation, which is a good thing. However, soy isoflavones can also produce an estrogen-like effect. And it's very similar to the estrogen that the body makes naturally. So it can cause some confusion. And in some patients, it's important to not have any additional estrogen around because of some other issues that we'll discuss in another lecture. So just be careful with these because they can cause some problems with your thyroid. Also, there's the cassava. If you don't know what that is, it's a vegetable. It comes from a root plant called yucca. Hispanic people would be familiar with that term. And the good thing about it is that it has a fairly low glycemic index as compared to white potatoes. The difference is that the higher the glycemic index, the worse it is, the more insulin is allowed to be released rapidly, leading to insulin resistance and issues that we'll see with diabetics. It's not a good thing. So it's actually better than a white potato if you had to choose. But in this case, because of the issue with the thyroid, you may want to lay off it. The millet is also a cereal grain that belongs to what they call the grass family. And it has much more fiber, which is actually good, and a lot of essential minerals than even wheat, rice, or many cereal grains. And it's also, we see it being used in alcoholic beverages and also liquor. So it's got protein and lots of fiber, vitamin B, other minerals that makes it useful, and it does not have any gluten, which is actually good. The big problem is that some studies have shown that the pearl millet can actually contain some substances that leads to enlargement of the thyroid gland, which is what we call a goitrogen, and therefore have some anti-thyroid effects. And so for that reason, when you're having thyroid issues, you may want to lay off it at least temporarily. So now we've come to the conclusion of our visit. Thank you if you've stayed with us to this end. And one of the important things that we know is that thyroid hormones does fluctuate. It's not a steady number. If you do a test this week and you do another one in a few weeks, those numbers can change. So it's important that we monitor it to make sure that what we're seeing is not just a temporary fluctuation and that you're really having a serious problem. So we're going to recheck the T4 and the T3, which are your thyroid hormones, the T3 being the more powerful, less of it, but more potent. We're going to recheck the TSH, which is the most sensitive indicator of a thyroid problem. And of course, we remember that comes from the anterior pituitary, and that's the area of the queen. And she's the one who sends out those messengers, the supervisors who go to the factory, which is a thyroid gland, to boost production of energy. Okay, so another thing that's really important that I would need to get is thyroid antibodies. And the thing is that, fortunately, science has discovered that there are specifically named antibodies that attack the thyroid gland. And we can tell some of them attack people with a low thyroid problem, like hypothyroidism, or low energy. And then there are those that attack people with hyperthyroidism, the complete opposite. So we're going to test to see which ones pop up. Most likely, we're going to find ones that are associated classically with Hashimoto's thyroiditis. So, Ms. Smith, you most likely have the most common type of hypothyroidism that we call autoimmune thyroiditis, which its popular name is Hashimoto's thyroiditis. But don't worry, let's take this slow. First, we're going to try to improve your diet, as we've discussed, and we'll try to decrease some of the inflammation in your thyroid gland, and this may help to reset it to a normal function. So my plan is to repeat your thyroid labs in about 6 to 8 weeks and to see if you would benefit from hormone replacement or the diet will be sufficient. So hopefully, once we repeat these labs, we will find that things have improved. So we're going to do labs today to see where you are, and then we're going to repeat them again in 6 to 8 weeks. So by the time we meet again, we'll have a lot of information about where your thyroid function is, and we can make our decision based on that. So how does this sound to you? So, doctors, thanks for simplifying a complicated problem. I feel much better and much more informed. I will definitely work on my diet. If I can avoid meds, that would be great. If not, I know that you will help me choose the right treatment plan. So that's excellent. We definitely will be here for you, Ms. Smith, and we will see you at your next visit, and have a wonderful day. Okay, so we've come to the end of our visit, And we will just simply review that we met with the patient. We went over the thyroid gland to explain to her how it works and why she needs it. We talked about the brain, the two centers, hypothalamus and the anterior pituitary, and how it works together with the thyroid gland to create harmony and energy that the entire body needs. So we explained to her what the TSH is and took a look at the urgent care labs that she brought and compared that to normal values. And we did an ultrasound to show that she does have a goiter, but it looks like a very simple goiter, so we don't probably need to do anything more about it except to follow up again, and a later visit may repeat it. So we also talked to her about options she has to handle the problem she's having. We talk about antibodies, autoimmune system, and you are what you eat, and the foods that you eat can affect your actual organs, and your thyroid gland can be perceived by antibodies, which are the soldiers of the body, as foreign if you eat the wrong foods, and they become incorporated in that organ over a period of time. So we decided to discuss some of the nutrition, the foods and so forth that are good for the thyroid and those that are not as good, and it recommend that she lay off some of the things like processed food and sugar. Added sugar for sure needs to be booted out of the diet. And we're going to follow her over several months. We'll see her back again in about 6 weeks, and we'll have lab results to compare to her urgent care lab results. She's very pleased with the visit. She's happy with where we are and our plan. And so she's going to go away much more informed and able to take control of her life and her body by understanding how food affects the body. So thank you very much for sticking through with us, and I hope that you will follow us, like us, subscribe to our channel, and follow us as we follow this patient into the future. We'll review the chat to see what's on your mind and what hot topics you want discussed in the future. Thank you once again, and you have a blessed and wonderful day.